Has anyone you know ever had a bumpy ride or even a horror story or two with Medicare? If so, stay tuned. If not, stay tuned. Hi everyone, my name is Rick McDermott with Senior Solutions Group, and we help pave the way for our clients and people who are referred to us or find us online how to understand the complicated maze that is Medicare and retirement, such as Social Security benefits, and how to make sure you have a secure retirement. We love helping people, and we're going to talk a little bit about the road that people travel on. Sometimes it is a bumpy road, sometimes it's a smooth road, anywhere in between. One of the things that a lot of people get caught up in is they get promised by someone they talk to, a friend or even an agent that does Medicare, saying, hey, just sign up with us and everything's going to work out just fine. This is the plan you need. Sign up for this plan here, this supplement plan here, this drug plan here, this Medicare Advantage plan, and it'll all work out. And it's the best thing in the world. And we're gonna just help you out. Well, sometimes the reality is that life happens. We don't have a perfect system. We have bumps along the way. Sometimes the system works like a sea of glass and you're just gliding right along and it works out just great. But there are other times when we encounter stormy weather and it's like you feel like you're on a doomsday course for a shipwreck. And we've had just a number of cases here in the last couple of weeks where we've taken the time to help people navigate this. I had a gentleman come in yesterday who heard about us from our local senior center here in Yakima, Washington, the Herman Center. And he told me his story over the phone, saying that, yeah, I fell and broke my hip. I was living in a mobile home and I was laying there for about 8 hours. I lived by myself and a neighbor found me and ended up going to the hospital, and he was basically dead weight. The neighbor couldn't help him, so they had to get the ambulance out and took him to the hospital where he spent several days after a surgery, and it was brutal. He ended up getting transferred to a skilled nursing facility. So for people that are on Medicare, if something happens similar to that, you won't spend your full time in the hospital recovering. You will be transferred either back home or, in his case, a skilled nursing facility. Since he lives alone, he needed full-time care. After about a week in that facility, his Medicare Advantage company denied his claim, saying that he no longer needed the skilled nursing care that Medicare allows for, and ended up getting they had him sign a waiver form attesting to that. Well, he was all drugged up. He had a major hip fracture and he was on pain meds and not really functioning the way he normally functioned. Didn't understand all the forms they had him sign. It's really a system that needs to be reformed. I'm going to be heading back to Washington, D.C. at the end of February to talk to our congressional leaders on these committees, these health committees, about these situations where people are in skilled nursing homes needing care and having these forms that are basically they're forced to sign. He said yesterday, had he known what he was signing, he would have walked out of there, because he said, I could have walked out of there. He has a bill here, and I'm going to pull it up on the screen here, for thousands of dollars. This is a past due bill that he received January 16th, a couple of weeks back, 2023. Upon review of your account, it has come to our attention that there's a past due balance of $7,946.70. Your total account balance with interest is $8,201.94. What should have happened is he should have had a $520 copay for those days that he was in the skilled nursing facility, as the policy read on his Medicare Advantage plan. But instead, they're asking for $8,200, where his maximum out of pocket was around $6,500. So above and beyond what all Medicare Advantage plans are required by law to have a maximum out of pocket. So for those of you who don't know, a Medicare Advantage plan is like having a substitute bus driver, driving your Medicare school bus of benefits rather than having Medicare drive the bus. So the insurance company takes over for Medicare and they drive the bus. Medicare waves goodbye as the bus goes down the road. So the insurance company is calling the shots. In this case, and this is about the 5th Medicare Advantage company that I've seen do this for people that are in nursing homes, where they kick people off the plan benefits and they're required to pay the full cost of care out of their own pocket. So basically this letter is saying pay up, and this person was not a client. He ended up calling an 800 number, by the way, which he regretted doing. If one of these Joe Namath commercials that he saw, he admitted, yeah, I called one of those numbers and they switched my plan over, and lo and behold, this is what happened. And so between now and the end of March, we were able to move him back to a more suitable plan for him. So just be aware, between January 1st and March 31st of each and every year, if you feel like you've made an error or called an 800 number, you weren't quite sure if that person, didn't know him from Adam, you can reach out to an agent that will help you. So we're more able and willing to help anyone that needs help, but there are other really good agents out there, so do your homework. We spent about, I'd say, a good hour on the phone talking to the nursing home billing person, and she was very helpful. Said, yeah, we run into this with some of the Medicare Advantage plans. Maybe not all of them, but a couple of them in particular they've had issues with. She said people that are on traditional Medicare, we typically don't see that happen. That is an issue we've seen more with the Medicare Advantage side on people that leave the hospital and need rehab care. And with Medicare, you could drag it out up to 100 days as long as you're showing progress. And the nursing home knows how to code that in your chart because they're required by law. I used to be a social worker in a nursing home, and it is required that in the chart notes that these nursing homes must document your progress so they can continue to receive Medicare benefits. So that's just one example yesterday, which led me to this article which came to my email today, Medicare Advantage plans denying 6% of prior authorization requests in 2021, according to the Kaiser Foundation analysis. So Kaiser Foundation puts out a lot of great research articles and information on all things Medicare, Medicare Advantage, Medicare prescription drugs, health costs in general. So they're doing great work to help our country figure out how to deal with this broken system. So of all the denials, right here it says only about 11% of denials of prior authorization requests. So a prior authorization, again, is when the provider must get permission for the insurance, the Medicare Advantage plan in this case, to pay for your care. Only about 11% of these denials for prior authorization requests were appealed. And the analysis have found, and we've seen this in numerous studies, that of all the appeals that were filed, the vast majority, 82%, resulted in a fully or partially overturning the initial denial. Well, if 82% of these appeals are getting either fully or partially overturned, and only 11% are getting appealed, that's a lot of people that aren't taking the time to file an appeal. And the insurance companies know this. So we spent about another 20 minutes filing an appeal yesterday to this company that handles these appeals up here. We called the 800 number. And the appeal was supposed to be done while he was in the nursing home, laying in the bed, drugged up. So we're hoping they're going to make an exception, knock on wood, and overturn this. And if it's 82%, he should hopefully, knock on wood, get this taken care of. We also called the insurance company as well to verify the dates of service. So when we called the appeal company, we were able to give them accurate information. We don't just sell insurance, by the way. We take this seriously. Our clients, we treat like our mom and dad. And we would want each and every person to get treated the same way we would treat our own parents. So which led me to this other link. So this article we're going to have linked down below. And if you haven't subscribed yet already, please do so, or share this with a friend at least, because this is important information. Very important. Over 35 million, according to the Kaiser Foundation, prior authorization requests were submitted to Medicare Advantage plans in 2021. And there is a limited set of services that Medicare requires. So if you're on regular Medicare, so with Medicare, you have two different types of options. You can use Medicare as your starting point or your primary insurance, or you can use a Medicare Advantage plan, which is like having a substitute bus driver. So what we're referring to now is regular Medicare. There is a very small list of services where they do require prior authorization. With Medicare Advantage plans, the list is extremely long and vast. So you might see in 2020, Medicare after July 1st required prior authorization for these procedures here. Rhinoplasty, that is a nose job. That's what that is. I believe this one here, blepharoplasty, might be a reduction for eyelids. Or it might be this one here. Vein ablation would be like if you have very varicose veins, or as the Norwegians and Swedes, I'm part Swede, would say very close veins. I know that's not very funny, but there are a couple other items here which are very expensive procedures where they do require another one would be if you've had repeated hospital runs in an ambulance. So if you have the habit of using the ambulance as your taxi service for non-emergencies, Medicare will often red flag that and will require, or the ambulance company can voluntarily participate in a prior authorization. So I guess you're sitting with the EMTs and then they do their prior authorization. They might be able to say, hey, you've had, according to Medicare records, this is your 10th time in the ambulance this year. Medicare may not cover this. Do you still want us to take you to the hospital? So Medicare, in large part, though, has a very small list of prior authorization requirements. Here's the list right here. That's basically just about a page and a half. That's very, very limited. So just be advised, all that glitters is not gold. All the ads on TV that promise you free this, free that, everything's free, 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 you got to look at both sides of the equation. We have clients that have Medicare Advantage, and there are very good features that Medicare Advantage members have access to. Extra benefits, health products. We have a great Medicare Advantage plan locally here that offers a local care coordinator service. So if you end up in the hospital, they will check in on you and make sure you're getting the best care possible. Wonderful company to work with. But there are other plans that may not be suitable for each and every person. It's not a one-size-fits-all solution. So this is just one example of what we've been dealing with in this week alone. We had another client that's been going through a months-long appeal process. She was on her husband's work plan through his employer, past age 65, and Medicare did not have a record of her being on that plan. She signed up for a prescription drug plan, and now she's having to pay late penalties 2 years after the fact. The previous Medicare drug plan didn't catch it, and now the next Medicare drug plan has found out from Medicare that she may have to owe a late penalty. So we've been helping her with this process as well, sending in her appeal form to the third-party vendor that adjudicates these appeals. And we probably spent a good 2 hours working on this case alone. Sometimes it's like moving heaven and earth. Again, we're not going to promise you the moon and back. We're not going to promise you that things are always going to run smoothly. Sometimes you get great care, but there's billing snafus. Sometimes the care doesn't happen. Sometimes the care is inadequate. The care doesn't happen the way it should, but the insurance works really good. It's just a really tough situation for some of our clients that we never promise that we can solve all of your problems. We promise one thing, that we're going to walk with you every step of the way. you might know another agent that will do the same thing. They're out there. We have a lot of friends that do what we do nationwide, and they do a great job. All we know is that you don't pay a nickel more to use an agent than you would going directly through a company to be an advocate. We don't charge a fee. We get paid by insurance companies, and we don't look at that as a transaction. We look at that as an obligation to you, our clients, to treat like our mom and dad through thick and through thin, no matter what it takes. We may not be able to solve each and every problem to your liking, but if we can make your life more bearable, that's our mission and that's our purpose. We had another lady that came in just yesterday where her Medicare number was somehow hacked and Medicare had to issue her a new Medicare number. And her drug plan wasn't letting us help her change it. They weren't updating it, where her Medicare supplement plan had it updated. So we don't hear about that all that often. We had 3 other clients that were on Medicare supplement insurance. One of them was not a client initially. They called us saying that I called an 800 number and they moved my plan, and I've been paying both my Medicare supplement premium, here we are in February of 2023, back to January 1st of 2021, on top of her Medicare Advantage plan with the same company. So the same company could not go back in their records and say, oh, she had 2 plans with us. We had to fill out forms and send them, basically proving to the right hand that they had coverage with the left hand within the same company. We had another client with that same company where he called to cancel his Medicare supplement plan. So these forms here we fill out on behalf of people who are our clients or who are not our clients, who just need our help. And often they become clients because they like the help we give them. We had another lady who had a drug plan, and she had a late penalty, and the company let us just call directly, and she was able to verbally say, hey, I had prior coverage, and that was good enough. Other times when you call your insurance company, you might get someone that sounds like they're overseas. A lot of companies are sending out their customer service numbers overseas, where their sales department, they're always in the U.S. So if you get an overseas call center, you have the right to request to be transferred to the U.S. So, and don't feel bad if you have to do that, because some of these call centers don't have the proper training. Or it might be a little bit more difficult to understand if you're hard of hearing, their accent. And often they will give you their quick answers, so they have a chart where you basically say what your problem is, and they're just reading off their rote answer chart. They're not really taking the time to listen. And you deserve that. If that's ever an issue, reach out to us at Senior Solutions Group. We're always available to help if we need to intervene in that case. Enrolling in Medicare, that's another issue. We've had people that call Social Security and get hung up on after being on hold for hours on end, multiple times. So now we're having people go directly to their local Social Security office and stand in line to avoid that from happening. Just yesterday, a gentleman said, yeah, I stood in line and said I need help enrolling in Medicare, and the person behind the counter said, we don't do that here. Social Security is the traffic cop for Medicare. He waited in line again, went to the next person in the next booth over, and they said, well, sure, we'll help you. That's what we do. Again, our system is broken. If we can help you navigate this system, we're going to lend our expertise and years of experience in doing so. Now it's February. Now is the time when people are paying high deductibles for their prescriptions, such as Eliquis. Drug plans are raising cost of drugs to beat the imposing deadline when they can raise the cost of drugs past the rate of inflation. And in 2025, when they're going to limit your out-of-pocket to $2,000. So now is the time when you get frustrated. If you go to the pharmacy, we had a client that called yesterday, said, yeah, I went to my pharmacy and my prescription was over $600. I thought it was going to be $45. Well, they forgot they had a deductible. which is the first part of the year. And then later on, they might end up in the donut hole where they're paying 25% of the cost of the drug, which could be over $150 for that prescription that they thought was going to be $45. Again, it's so confusing for a lot of people. Our job is just to simplify it, make it easy for you to understand. Reach out to a local agent. If you don't have one, feel free to reach out to us at seniorsolutions.net. Again, subscribe to our channel. We are here for you. We are constantly updating you with pertinent information. I'm heading to DC soon. If you want us to talk to your congressman or our congressman about issues that are concerning, reach out to us, message us below, and we'll make sure that we reach out to them as well as you with any concern that you have. Any of these issues can be done by yourself that we've talked about, with a lot more time, a lot more headache, and possibly a lot more tears. You owe it to yourself to save you the time and the worry and the frustration wondering if it's done right. Reach out to us anytime. We're here for you. We appreciate you. We love our job, and we are Senior Solutions Group. Thank you so much, and have a blessed rest of your day.